Is it on? Hello. Welcome to the session focused on fundraising, which will be not any fundraising, but fundraising fit to a small organization, but bringing the biggest impact we can perform. So, the slides, please. So, how I move? Okay. I will move. Okay. So just briefly to introduce our organization, Diagnose Leukemia, which is celebrating 20 years next year. We started as a CML, patient organization, because that's my disease, since 2002. And you can imagine that was different times than now. This is an authentic patient-led organization which is connecting patients with syndrome and myeloproliferative disease. The board is composed of 3 patients with strong patient stories. They are younger than me, and they had the young ladies who both had children during their treatment, so this is a very strong patient story, and at the same time they have a good prognosis, so it doesn't happen that we lose board members, which is very discouraging for the patient organization, of course. We are registered as a non-profit society, and the statutes we have set up is for AGM each 5 years, which happens, of course, remotely through email. So this is it. Oh, I'm trying to. I don't know. Anyhow, we are a voluntary patient organization where I'm not only the chairperson, so-called representing, but because I am the co-founder, the work is also on my shoulders as managing the organization. The board members are really concerned about ethical way of managing the organization, so they encourage me by saying, it is done ethically, so I'm happy to hear that. We have a collaborative group of 3 nurses who serve as hostesses at our events, and I fished them from the times they were at school, and now they have learned to communicate with patients because they're from different specialization, but now they really learned the specifics of blood cancer patients, and the patients like them, and we became like part of the patient family, of course. We have a student for IT support, and the only professionals is a webmaster who takes care of the technical aspects of the website, and of course professional accounting. When we set up the organization, everybody asked, and where is the offices where I come to the offices? Now this is ridiculous, talking of fundraising, that I cannot imagine a bigger waste of money and bigger waste of my time to drive there, park, and perform the work that I can do in a small corner of my living room with a computer and a printer. I rented a storeroom downstairs of the apartment house to keep the printouts and the files for the accounting and so on. And I have also created some small working spaces in my country properties where I spend the summer, because there's teleconferences basically all year round. Whenever there is individual meetings with patients who want to see me face to face, just one-one, or with other stakeholders. It happens either in hospital or in the offices of the industry or in public places. How we started. At the time when we started, there was no information about leukemia, especially not in Czech language, because the targeted therapy was just getting into practice very slowly. So we formed like patient groups which were mainly for the psychological support and discussing what would need to be done to improve patient-doctor communication. That was a really big issue because only since 2006 we had legal access to our medical files. So before that it was up to the healthcare professionals to give us whatever information about the state of health. These groups we would meet up over coffee and so on and discuss these issues. At that time, I felt every hobby costs money, so I financed basically these meetings myself. It wasn't a big issue until the patients told the hematologist in the clinic where we were treated what's happening, and the doctor herself told me, you don't need to do that because industry would be happy to support your activities as a patient organization. So that was my first hint about approaching pharma industry. And the first thing I learned from the manager when I met him, he said, in a month's time there is CML Horizons in Dublin. So if you like to go, of course. And same as you here, see the benefit of patient advocates gathering together, learning from each other. For me, it was really eye-opener because these were Western patient advocates with organizations that some of them had already some tradition. And when I saw the scope of activities and the impact they make, I realized it's much, much more than just mutual support between the patients. So I rushed to get some know-how, how to start, how to fundraise. This was on the agenda also of this conference. So when I got back, we really finalized the registration and started to function with this model. Also, I must say that it helped us from the approach of the society, general public, medical society, patient organization. What is it? It didn't have much tradition in my country, and I told them it is not that a couple of patients got wild. It's a best example from abroad. Look outside of the country in Europe. It is very well functioning, and it is clearly a positive way of adding on the healthcare services that are within the system. This is something additional. So how about fundraising then? Of course, we have to raise funds for purposes that have the highest impact. We found that what is very much needed is to connect patients with hematologists outside of the consultation offices. As we heard even today and yesterday, there is some ideal ways to communicate, an ideal time, but this does not show in practice in our healthcare system, which is very pragmatic and very, I would say, robotic. So you don't get this very personal approach. You get strict information in a time which is limited according to what the health insurance system pays for. So then whatever connection between a patient and a hematologist could be added on and can be arranged by the patient organization, I see of great value. So we designed these patient conferences, like here we have patient meetings, not for advocates, for patients who wish to come, and bring hematologists to explain in layperson's language about the disease, about the diagnostics, about treatment options, about clinical trials. So this gives definitely much more time than what the clinician can perform in his consultation when he deals with a particular case of a particular patient. Here he gives a broader picture. And of course, it also gives a chance for the caregiver to listen, because many patients are not accompanied by caregiver during their consultation. So here, the same chance is given to the accompanying person. And of course, it also gives chance to talk to the experts over coffee during the coffee breaks, arrange second opinions. This is the place where they can ask if it's possible. Otherwise, you can't go to another clinic, knock on the door, good morning. That won't happen. So I think the benefit of these meetings is immense. I try to address really the leading hematologists. So even people who haven't been in the care of a really high-profile specialist, at least they can meet him up at the meetings, and then they don't need me anymore to arrange with him whatever they need. It's up to them. So these meetings, we have 3 at major university cities, which form a geographical triangle of a country. We're a small country of 10 million population. So nobody can say the meeting was in a remote place where he couldn't find ways of transport. So that's pretty simple. For myelodysplastic syndrome, these are elderly people, very fragile, so we make small seminars at their clinics, but that's another story. And also what's important is to have a website for the outside, for the general public, and this is also a place to put information on the disease. I found successful the format of videos, so to film, for instance, 1 hour discussion, like an interview, but cut into, let's say, 3-minute, 4-minute sequences where there is a question and answer. So the patient doesn't need to listen 1 hour lecture. There is short video sequences that will answer his question. So this is the basic. When a patient is diagnosed, he can go to this, and the first question he has after being diagnosed, he can find reliable information, because the authors of these videos are really the leading people of the Hematology Society. Here is a picture of a CLL session at our Prague conference. So I want to say that when we expanded, it means that our organization got more visibility, more credibility with the other stakeholders like Ministry of Health and mainly the Health Insurance Association, because of not covering just a single disease. So the mandate is stronger. That is the advantage. On the other hand, I named here some challenges, mainly for me, because basically I'm not doing anything else, not even household. Everything's for the organization, you can imagine, 24 hours. And, you know, for me, that I lived many years and still there is a question mark, in certain uncertainty. And I would say the heavy work is the answer to how to kill the time for that. Finally, I will finish my presentation with highlighting the spirit of the organization. Since we are a voluntary organization, basically I can say I am somehow following the vision which I have. I don't say this is the only and the right vision, but this is my vision, and I'm fulfilling it. And in the beginning, it was difficult for some people to understand. For instance, directors of hospitals would call me, and they would say, Jana, patient organization should do 1, 2, 3, 4, 5. I said, maybe in the next life, when I run a professional organization, I will do it. But right now, first, I'm not your employee. I don't belong to the hospital. And I am, number 2, following my vision. So that's the end of the story. And people say, you are very daring with these high-profile people. I always say, what can they harm me? What can harm me more than the disease already did? So basically, I don't need to be afraid of anyone. So I can, if you have this approach, I can tell you, highly recommend it. Besides that, there are some activities that really don't require funding. They are based on your time and your willingness, what you want to do. For instance, okay, engage with healthcare stakeholders. There are different working groups at the Ministry of Health where they're lacking patient representatives. There is, I'm engaged in e-health and in access to innovative therapies. So I consider this is important and won't let just the I don't know, government officials and medical representatives to occupy the chairs there. Should be patient around the table. Also, with the health insurance agencies, I can bring either individual cases of patients who were denied access to a particular drug which is not reimbursed by standard ways. It needs a special process. And maybe the doctor was not willing to go through this complicated administrative process, or he did and still didn't work because the reasoning was not strong enough for the decision. So then it needs a little bit push and discuss such cases, even if there's concerning a subgroup of patients. Meetings with drug regulatory body. The drug regulatory body wants to look human, so they're also inviting patients. They haven't enough, apparently, because they're inviting heavily. So, okay, if they want problem, like in the health insurance, when I come, they say, not again this one. No, they will see me. If the problem persists, I'm coming again. So these are activities which really doesn't happen every day, and I think it's good to be there. Running of non-stop telephone helpline looks terrible, but in fact it isn't, because I must say patients are very reasonable. They wouldn't call in the middle of the night or something like that. They want to get some information about a doctor in particular clinics, or, you know, general things. They know they're not speaking to a doctor, but an experienced patient. So I am happy with how it's going on. Posting news on the Facebook of the organization and posting the same news on the website for patients who don't like to use Facebook. This is a parallel way of publishing whatever is happening within the organization and within our international activities. And of course, promoting patient organizations via medical contacts outside of hematology. I was surprised already when I talked to 3 different specializations than hematology doctors. I gave them my business card, and then I heard something like, you know, my father-in-law has CLL. You know, it's just by chance I will give him the contact, so that's a constant work. So thank you for your attention, and we can discuss your experience.
So I'm going to ask first, does anyone have questions for Jana and for her experience, and perhaps how it... Sorry, we need to use the microphone because it goes through and it goes... That's right.
Okay, Peter, here you are.
I should have remembered that. Sorry.
No problem.
I do want to see if you have questions for Jana and through her experience. Many of you have been through the same experience, but obviously everyone has their own direction that comes from your resource, that comes from your culture, that comes from your medical community. So sure, if we have questions down here, I will bring the mic to you. Cindy first.
Okay, thank you very much. That's very good sharing. And that's all the problem I'm facing. Like, I would like to ask a little precise question. This is all about raising funds, so it's all about money thing. How did you receive the money? I mean, you get them in cash, or you ask them to transfer to someone's, or how do you do that?
Well, first of all, I must say Czech Republic is a part of European Union, which is not only regulated, I would say it's over-regulated. So it's the rules of the game are given. You know, there is very strict processes how you request the money. Usually it's online. The company has online format to fit in. Sometimes it takes, the maximum I had was about 7 hours filling it in. And, but once you learn, it becomes more a routine, I would say. So, but each sponsor has different formats, but the basis is the same. It must be transparency, it must be rules for what they can fund, what they cannot fund. So there's no use trying to put in something which is nice to have, but will not happen. So you have to know this. You are in a different environment. This is some strongly regulated environment that we are living in. You know, you have to first fit some criteria, the organization itself, you know, then you request for certain purposes. They cannot find any purposes, but like for the conferences, because that's similar like this one, just with the patient participants, so that's possible. So if there is everything clearly explained, the agenda, the purpose, and so on, there is a chance for that. That's why I choose activities not with the question mark, but those which are clear, ethical, can be well explained, and the outcome can be measured, you know, in a transparent way.
My question is about the funding. Where do you get it? You mentioned about pharma, but is this the only way this organization is funded? Do you have access in your country, since you are part of the European Union, to Euro funds, to national funds, or is strictly funded by the pharma?
Strictly by the pharma.
Just to add something on.
Yeah.
As well as from funding from government, because in our country we don't have government funding for NGOs,
yes.
Like Slovenian example, they have.
Yes, well, I go the sure way where the standards are set up, where I have experience with, and since I'm the only one who's performing this, I won't complicate my life with experimenting something that is with a question mark, you know. For some other ways of funding, which you have mentioned, is pretty complicated. Also, the funding is too robust for the size of our organization, because always you have to like make clothes to the measure, you know. So there is no use trying for a grant of, I don't know, something huge money if we haven't the mode how to spend it in a way that it will be transparent and clear, and it would be just give it a try. No, I can't say my energy, I cannot waste on things which are just give it a try. Even that is not sure, the funding might come lower than we request, but you know, at least it's something very transparent to make a budget for a patient meeting, you know. There isn't anything hidden in there, you know. It's something clear cut, doesn't raise any questions how we spend the money. And we can easily, I mean, the way when we, after performing the patient conference, we report, we give the result of the financial costs and everything. So that's all very transparent. Everybody understands it. It was used according to how we demanded. Yes.
First of all, thank you very much. I really appreciate your presentation. It's so inspiring to me because, frankly speaking, my organization is not in the legal account. We're just a normal organization, you see. So if you would like to have the fund in order to make a campaign, if you would like to ask some funding from the pharmaceutical company or other organization, I have to be the invoice, you know, the invoice to give to the pharmaceutical. But in the initial state, I don't give up because I would like to give the knowledge, okay, to our member and to the public, because talking about the MPN, for example, MPN is quite a rare blood cancer, you know, and most of the both patients and the public, they don't know much about the importance of this blood cancer. But we are a small organization, no money. So at that time, I don't know how to find the money, how to find to get the funding. So I use my connection. So I know the president of the foundation, which is quite a national foundation called Thai Cancer Society. Okay, this is the foundation, and the president. I talked to the president, and the president try to tell him our mission, our project, our campaign, that at least we need some kind of the Facebook Live seminar, so that both patient and public, you know, can have a channel to know the knowledge of the disease, MPN or other leukemia type. So that's why when I complete this, I don't know this is a funding strategy or not, because I don't have to pay anything. Thai Cancer Society happy that, oh, this is a very good idea. So all the responsibility, they will take care for me, so that Thai Cancer Society can contact hematologists, the Thai MPN working group or the group of the doctor, 3 or 4 doctor, to be the speaker by using the live Facebook webinar for about maybe 3 hours. See, this is kind of my strategy at that time, because I have no fund. Just to share my experience about this.
Thank you for that. Are there other questions from the floor here? Okay, and if you have more questions, just of course raise your hand and we'll incorporate them. Jana, I think you said some very, very practical good things there. What I liked was one thing you said about you're very focused, and I know you are very focused. There's temptation for all of us when someone asked us to do something that's sort of outside of the realm of our expertise or the service we offer, we want to perform that too. But the bottom line is you often wouldn't have funds to do that. So you have to be true to the vision of your organization, because the vision of your organization is also often the passion that you bring to the organization. And you want to make sure you're always doing top level stuff, right? You also talked about putting priority to funding and understanding where the biggest accomplishment for the dollar you spend is.
Yeah.
And these are decisions we all have to make. These are decisions that we all make differently, given what the situation is in our own country, given the medical situation, given the other associations that help within the patient advocacy sphere as well. And that can help give you that priority to decide how much funding you need. Another thing that hasn't come up today, and you probably do this in great sense, is partnerships as well. There's always that opportunity to partner with someone unconventional to help offset expenses of various types. Sometimes it's a case where your patients are business people as well. They may own a stationary supply place. They may be able to give you your pens and paper and all these little pieces. They may own a different kind of a store where you can get supplies for a conference you hold or something like that, or offer a space or these kinds of things. Because this is the third thing that I've learned from you today is look for all of those free opportunities, because there are a lot of free opportunities to do things that you wouldn't think of necessarily, but the lobbying that you speak of, things like that.
Yeah.
And that's very good. Now, I just want to, with the time we have left, and Myrna, are you up to speed on the time? No, I know. I don't know what our timing is either.
But we are close to the end.
Yeah, somebody will time. What I would like just to do, we'll just do a really quick exercise to give some thoughts, because I always like people can leave these sessions, and if you leave with one thing, I didn't think of that before, or I wonder if we can follow up with that, whatever. I just want to come up with a few ideas of what are the how much time do we have, Lydia? 5 minutes. All right, this is going to be a speed round. Some ideas about what are the priorities for funding that you have. What do you get the most dollar for the funds you spend? This doesn't mean it's the biggest thing you do. This is what do you get the most impact for the dollars you spend. So think about that for a little bit, just very briefly. And anyone can give me some examples of what you think you get a big impact for the dollars you spend. John.
I think our website.
Okay.
It's a critical communicator, and it gives us access.
Right.
And it's the go-to place for our membership. But it costs.
Now, what do you do with your website to do that? Like, how do you make an impact with the website? You keep it up to date.
Yeah, that's critical, because if it's old information or dated and visually attractive, and one of our biggest tools in there was an accessibility tool.
Okay.
So you could, even though English is the dominant language in the UK, it's a multicultural society, and we have translations. Oh, sorry. And we have translation availability. We have visual impact insofar as if you need a dark screen or if you need a black and white screen, all that, and it makes it more accessible. And even we had a CNS, clinical nurse specialist, tell us once that they had a person
who they didn't have a translator available, and they were able to use our website to translate their consultation. So all that, and it doesn't cost a huge amount of money. We pay that over a 3-year fee, and it also enables us to leverage funds from pharma because we have that tool. It sits very nicely in their corporate social responsibility box.
You know, a website, you've latched into something very important, because when you have a website, it's not just we have a website, but as you said, we have content. We have up-to-date content. And if you choose, you can break that content down and use elsewhere. Yeah. Pamphlets, social media, however.
And it sounds like we're really advanced, but we celebrated our 20th anniversary last year, and we talked to one of our founder members about way back when, and they said they went to a conference about voluntary organizations, and at a coffee break, she was talking to somebody, and they said, well, how did you start off? And she said, well, we got a grant of 150, and we managed to do this. And the guy said to her, wow, you've done an awful lot with £150,000. And she said, no, £150, and we would still dream of a grant of £150,000.
Yeah.
And that was 20 years ago.
And the good point there is, if you are working a website or revitalizing a website, shop around. Get different quotes, because you'll find such a variety of prices, of offerings out there, and you need to fit that budget again. You need to fit that budget. So you're creating content all the time, which you can use in multiple forms. Also, this is a database of information representing your organization, and that lives on. And every time you add a page, every time you add the report from an event like this, every time you add a press release from something in your country, that is more information, and it makes your site more fulsome. It gives you more credibility in the community as well, and more searchability as a website. So you grow like this very quickly. And you mentioned too the accessibility aspect. Accessibility, we're all going to hear more and more and more about that. It's not going to go down, it's going to be more important. And with the accessibility, it not only offers the accessibility, which is wonderful for someone like me who has glaucoma, but it tells people that you're up to date. You're up to date with where you need to be, because it's the people who don't follow things like accessibility, we're not there yet, that they're a little more skeptical about the information as well, if they don't care that much to get in the head and understand the people using the website. Myrna. Yeah!
Quick one from me.
I just want to say that because the topic is the fundraising, we all face the situation where we actually do not have those funds for that website, which can be very expensive just to build it and to maintain it. So what we did in Croatia, we asked for the companies who does the website to give us help, to promote us, to help us, to give us smaller prices. And then we educated our staff, not staff, but the volunteers, to actually update the website. So that's how we save the cost, because we know we live in the era when this maintaining and having the website costs a lot. So that's what we did.
We have to wrap up. Sorry, but hold your questions and you can ask
Just,
them during break.
we'll just do one more question, then we'll be it. Okay. I'm still running the show
Okay.
here.
I'll make that. Okay. Okay, I'm going to make that very quick, yeah.
Yes.
Other than the website, and what we do is on the Facebook, yeah, that is a short form of digital things in the website, yeah. It's free if you're not paying for anything, and then it could be updating quicker, easier, and make things simple, yeah. Facebook, website is something more large, like a big company. Yeah, so social media and Facebook is something shorter. You can do that every day with short passages, and you can do in video, you can do in photos, you have graphic photos, and that make people more understand easily.
And think of this concept. If John does a blog, you'll be able to find 10 separate social media posts of information from that blog. Each little point. We're all yours. Thank you for the time today. Jana, thank you very much.